A stoma is a portal in your body. It's most often built in during something like bowel cancer surgery, where a surgeon attaches one end of your intestinal tube to a small hole in your abdominal wall. And a pouch connects to that hole and sticks to your belly where it collects your poo. And that gives your bowel, further down the line, a chance to heal. Now, stomas are more common than you might think. I was surprised to find out that at any time, more than 40,000 people in Australia have a stoma.
Oh.
Yeah, some are permanent, others can be reversed, but still it must be quite confronting to be told that you need to poo into a pouch, even if it's just for a few months. So I spoke with Leanne Johnson, a stomal therapy nurse at Logan Hospital in Brisbane. And as this perhaps is not a familiar profession, I asked Leanne about what she does.
We are known as fix-its sometimes. So I wouldn't say a dog's body, but we do a bit of everything. So we are trained in wound management, stomal therapy and continence nursing. But the majority of what we do here in my workplace is looking after people with a stoma.
And one of your patients last year was Marlene Rogers. Marlene, why did you have the surgery?
I had a lower bowel cancer. I woke up with the ileostomy, which is connected to my first intestine. I was not daunted by finding that because I had very good information from Leanne and her team regarding just what it's about. It certainly is the inside coming out.
Inside coming out indeed. But before going into surgery to remove part of your bowel and have the stoma made, how did you feel about it?
I must admit I didn't want to go ahead with it because I think there's such a stigma around people with bags on after surgery, and I didn't want to go ahead, and my family rallied around. And I mean, I was all for living, but as I said, the stigma that's connected to a bag is very real until it actually happens to you. I think a lot of people think, ooh, you know, you sort of feel like it's a bit of a toad situation that you don't really want to have anything to do with or know anything about.
So thanks to your family, you went ahead with the surgery. And have you had any problems with the stoma or the bag since?
The only issue I had was the skin problem.
Leanne, do you see many skin problems with stomas? How do they happen?
The skin isn't used to being covered 24 hours a day by a glued-on appliance to catch the fecal matter. So the skin under there, if you can imagine, it's a little bit suffocated. The hair follicles are squashed and compounded. People can sweat, especially up here in Queensland with the humidity. The skin concern is a really big issue for us, for anyone with a stoma surgery.
And how did Leanne clear up your skin, Marlene?
She got a Manuka honey-infused bag to attach, and I haven't looked back. I've never had to go back for any further help. And that was, I don't know, about a month, 6 weeks after. So I'm coming up to over 6 months of having no issues ever since. And I sort of refer to it as my first fermentation. Dear. And I've got a nurse daughter, an RN, and she said, "Mum, it is not the first fermentation." I said, "Well, I'm telling you, that's what it smells like." Dear.
It's actually an interesting point you raised, Marlene, going back a little bit to when you mentioned the stigma of it. And I tell this to to all of my patients in our pre-anaesthetic clinic before their surgery, because their immediate reaction is, no, thank you, I'd rather not have a bag on my belly. People are going to see it, people are going to smell it, etc. And I always tell them that at any given time in our country, there is between 40 and 45,000 people that have a stoma at any time, be it permanent or temporary. There is a stigma attached, but the appliances, pouches, bags these days, they are so discreet and streamlined, and they've all got filters. So really, you shouldn't smell anything unless you're taking it off to change it. And hopefully you wouldn't see anything unless you walked around with your T-shirt up saying to people, look what's on my belly.
Marlene's stoma is a temporary one, but how do you prepare people who are faced with having a permanent stoma?
Essentially, it's the same education and the same support system between a permanent and a temporary stoma. It's when we get to a point, if we know definitively prior that this will be a permanent stoma, then the pressure is on us as the stomal therapy nurses actually to mark the abdomen well. And by that, I mean we have to look at the belly, which we did with Marlene. We do a full abdominal assessment. We literally draw a mark on the stomach so the surgeon knows where to create the stoma. So if we get that wrong in a known permanent stoma, that can have lifelong implications for the patient. But we generally do tell patients that, this will be your new bum or bottom on your belly. So that can sometimes be a bit of an issue with people thinking, they're never going to go and sit on the toilet and do the natural thing ever again.
Marlene, between your diagnosis and surgery, you took your family over to Western Australia to swim with whale sharks. Now, I'm supremely jealous of this. Tell me, how did you feel when you first jumped in for a close encounter with a whale shark?
You look at them and you can see their eye, and they're just a most magnificent animal. Oh, take your breath away. When I first saw it, it just took my breath away.
We knew that she did want to do that before she had her surgery, and people will try and plan those things, but just really quickly, having a stoma and wearing a stoma bag shouldn't prevent anyone from living a normal life. We can send people off swimming. They can sit in a bathtub for 3 or 4 hours. There's no reason they can't return to a sport they used to play, all those sorts of things. So I guess it's just about educating people on what a stoma bag means for somebody and making sure that they retain their quality of life that they had prior to their surgery. So Marlene's testament to that. She's gotten on, and to look at her now, you wouldn't know she's even got a bag under her belly or what she's been through. So if we can do a little bit as a stoma nurse to help our patients through that, then our jobs are done.
Leanne Johnson, a stoma therapy nurse at Brisbane's Logan Hospital.